seeing people who just like had really bad reconstruction, to be honest, and like, fixing it and then seeing like their whole personality change.
I have this woman, she's 35 years old, she lost 150 pounds. I mean, I swear to God, I wish I could do the case for free. Her neck looks awful.
I mean, would you say that the world of AI and just out of control social media makes it more difficult these days to get those expectations in line?
If somebody comes in and wants to look like, a certain thing and they don't have that frame, I'm not going to operate on you because I don't think I'm going to be able to make you happy.
Give it a sec. What are you thinking, Dom? Let me hear. He was going to say something profound, I can tell.
First of all, it's really good to see you.
Oh, it's always good to see you.
I didn't tell you that earlier before we were in the prelim here, but it is really good to see you. Man, you look good. First of all, it looks like you're getting shot out of a cannon. It was a heavy week.
Poof. It's been super busy. Oh, wait. We got Eddie Rednam.
Hey, sorry, y'all.
There she is.
No problem.
Great to see her.
How are you doing?
How are you?
You look great. I broke my hand this year, so I was like, hiding it and operating with it. So it was one of our episodes where I fell off my scooter.
Yeah.
How far is your house from your clinic?
Oh, like 10 minutes.
Yeah. Again, you made it home quick.
Yeah.
Okay, Dom, I'm going to let you run with it on the head, I think, here a little bit.
Oh, man. I mean, first of all, we're so excited to have you. This is going to be a great time for you because it's all about you. And the whole idea of this podcast is for people to help them get more them out of them, more you out of you is really why we call it that. So I want you to just, first of all, be super comfortable. You're in good hands. And we're so excited about having you. And I think I was going through all your stuff and I was trying to actually be honest. I was trying to look for questions that like people wouldn't normally ask you, but I think I have to ask you some of the normal questions too, right? To start out with. And one of the things that I thought was interesting, like, you being a surgeon and some of these going on, it seems like you started to create this like really nice niche and this bit of focus on like post weight loss. Mm-hmm. And I just was hoping that, like, what are you seeing really kind of in this like post weight loss world right now?
Well, I think it's like, there's communities that have been built now. There's celebrities in the post weight loss world now, which I think is really interesting. I feel like even 5 years ago you didn't see that. But it's a niche I like partially because the people who are the people, I guess I don't want to say patients because they're people, but the people involved with it, they they're very realistic in what they want. Mm-hmm. For majority of them, it's not just about how they look. It's about a better quality of life. And I think it's a happy environment, right? They worked really hard. They lost this weight. They're healthier. And I feel like with what we do in plastic surgery, like it's awesome. Like we get to help people realize that dream in a really healthy way. So.
Sweet. Okay. I just want to be sure because what you're saying is amazing and I want to make sure we catch it all. Ben, you were going to ask a question.
Yeah.
Jump on it.
Likewise. I mean, I think the post weight loss patient or person, as you said, very appropriately, they're so grateful. I mean, they feel good overall. And unfortunately, the skin component to it, I have this woman, I think I talked about her last week, Dom. She's 35 years old. She lost 150 pounds. I mean, I swear to God, I wish I could do the case for free. Like, her neck looks awful. I mean, just to be blunt about it. And the poor woman feels great. She lost this weight. She had been big her whole life. Like, you could see it was like this whole monumental change she was going through. And she's like, but my neck looks like shit. And I mean, she was right. It looked bad. So, I mean, we're going to fix it and she's going to pay. I would do it for free. I promise if I could. But some of those people, they're in the right mindset now. They feel awesome. But then, I mean, some of the skin is just hard to deal with at a certain level.
And 35, like you don't want to look like you're a 70-year-old woman at 35.
No, 100%. I mean, insurance should pay for it. I swear to God. I really think they should at this point. Some of your stuff, do you get anything covered?
I do get part. I can get, if they have like all the medical documentation, I can get paniculectomy and breast reductions. But that's about it. Even with documentation for other things, insurance won't cover
nothing. Yeah. I mean, it'll be a matter of time, I would think, when like the mental health component of that is gotta come into play somehow. So,
what I was going to ask though, in this kind of post weight loss world, are you seeing like almost equally men and women? Are you seeing like one more than the other? What are you seeing?
I'd say still majority women, but compared to like my general aesthetics population, I see a lot more men. So I do think the number of men is increasing. I think that women are still more, I don't want to say particular, but they care more about certain things than some of the weight loss men do. But for body contouring and chest surgery, I see a lot of men for that.
Okay. And then anything for people that are on their way of losing weight, like as they're going through the process and anything like that, is there anything they could or should be doing to help it along by the time they get to you? Like, is there anything they should be thinking about on the way?
I mean, a lot of what they're doing to lose weight is usually preparing them, right? So, like, they have to make sure they have good nutritional status. So, hopefully, losing the weight in a healthy way. I'm a big fan of anaerobic exercise, right? So, I think everybody should be lifting weights and putting on muscle because they're not going to get to exercise like they normally do while they're recovering. And I think mental health is a huge part of it, right? So, I see people who didn't really, they've lost weight, they did all these things, but they haven't really taking the time to talk about the mental reasons for why they were in the position they were in. And so those don't go away after surgery and they sometimes
Yeah.
get worse. And so I think that really sitting down, spending that time to be like, okay, my body's recovering, but I need to work on my mind now too. Because that's the only way that you get to the other side of this and you feel really good.
Yeah.
So speaking of that, you're known as the confidence doc. And by the way, I love that branding. I think it's just so great, and I think it really embodies what it is you provide for people, which is so wonderful. First of all, I have a lot of questions about the parts of things that you do, but where did this idea of the confidence doc come from?
So I guess I don't know. We started like several years ago, and I was like, oh, I want to come up with a name, a catchy name. I don't know, and
Yeah.
but we couldn't quite figure out because I do cosmetic, I do reconstructive, and we just my team and I were sitting there, and we were just like, well, what's our end goal for every single person we take care of? And we're like, well, we want them all to feel confident. And then I was just like, well, that actually sounds pretty good. So that's really where it came from is that it doesn't matter what we do in plastic surgery. We want our patients to be happy and confident.
That makes sense. Was there a patient moment for you that kind of lit that idea up in particular? Was there something in particular?
There's so many patient moments like that, right? Like, I mean, like, I honestly would tell you it started with my breast recon patients. Like, like seeing people who just like had really bad reconstruction, to be honest, and like, fixing it and then seeing like their whole personality change. It just, like I said, just all of a sudden someone who was like hiding themselves is now dressing in like a sexy red dress and coming to a clinic that way. It's just like, that you've made people feel good about themselves.
Yeah, that's so great. And is
It's
there, I know you mentioned one thing, but is there a surgery you would say that gives like the most confidence? Is there like a certain one like category where you're like, oh, this is like people feel just amazing from that.
I guess
the,
if I had to pick one thing, it'd be like a tummy tuck or a body lift. Like that
yeah. I mean,
really, like,
those weight loss ones.
yeah.
Those people are. I mean, they're unrecognizable when they
Hmm.
lose that kind of weight. And I think we're going to learn a lot about these drugs being like power. And not all of them are Ozempic. I know everybody gets
Yeah.
that assumption now, but we're going to learn that like people are going to live longer for a lot of reasons. I
Hmm.
think when they get feeling good, looking good, kind of thing. Yeah.
Oh, that's great. Um, and I think what you're doing for people is indeed like giving them that confidence back or confidence maybe that they never had, which is great. Is there anything where people come to you for surgery for something and you're like, hey, that's not like a surgical, it's more of a non-surgical thing that we need to do for you? Is there anything that you see in your practice that's like that?
Um, I don't know that I get that much that I'd say is like if someone comes in non-surgical, I think it's just sometimes it's more of an expectations type thing. If somebody comes in and wants to look like, a certain thing and they don't have that frame, and then that's in regular, not necessarily post massive weight loss patients too. It's just sometimes trying to keep expectations real. And so it's like in those cases, it's like, I'm not going to operate on you because I don't think I'm going to be able to make you happy with this. But I don't think there's that many times. Sometimes I would say more for facial procedures. Sometimes I'm like, that's a really good filter, or good makeup contouring. I don't know. So
And is it, I mean, would you say that the world of AI and just social media, like out of control social media, makes it more difficult these days to get those expectations in line?
yeah, 100%, 100%.
Yeah.
Like I
Yeah.
recently
Yeah.
saw another plastic surgeon had done like a pretty like well-known weight loss influencer, and she looks awesome. He did a great job. And like all these comments, like he literally had a post that was like, "This is why I hate people," and it was like all
Yeah.
these comments, and people are like, "She's not that flat. She's not this and that," and he took like 30 pounds off of her. It's just
Yeah.
like
Like literally of the,
we've just gotten in this
yeah.
stage where no one can be realistic about it, and the patient's
Yeah.
super happy. So why is everyone sitting there trying to point out every flaw? You know?
Yeah. Yeah. I really wish I didn't have to do as much social media marketing from that perspective as I do. We have social media people in the office, and I know the damn platform is better than all of them because I've been doing it for so long. I know like all the ins and outs, and I'm like, oh God, I wish I didn't know this. Um,
Yeah. Well, and I think it's, and look, it makes your guys' jobs a lot harder. I mean, there's two things. First of all, you have people with expectations that are just
Hmm.
not realistic. And then in addition to that, you constantly have critics basically telling, by the way, critics that really don't have the education or the know-how or any of those types of things. They're just normal
Yeah.
people going, I mean, a thing that's worse too is you put a really nice before and after and they're like, that's AI. And you're like, no, no, it's not. I actually did that.
No, what's better is like the people that like they're like that side's higher than that side, or this
yeah,
is. I'm
so
like,
I do.
shut up, come on.
It's like, oh my God, yeah.
Why don't you
I,
come
I
in
love.
next time and tell me how to do it?
I like the haters. They feed me. I was telling Dom. Dom was like, "What should we ask her?" He's like, "What do you want to ask her about surgery?" I was like, "Man, honestly, at this point, the surgery is that's like the easiest part of my job is the surgery. It's like managing all of this other stuff. I mean, if I could just operate all day and not have to talk to anybody and deal with the marketing and the running the office and all that, it would be like fun and games." I'm really interested in your non-surgicals. I think you're doing a really good job. I'm pretty sure I saw you were at like Paris Fashion Week or something.
Yeah.
I mean I'm interested in that aspect because running the practice, being busy surgically is one thing, but then tying in. I mean, you have your podcast. I was on your podcast. I mean, you're just piling it on.
Well, I don't know. I guess like I got to a point where I'm like, okay, I got a busy practice. I still always, I feel like
Hmm.
you always want your practice to keep growing,
Yeah.
but there's just a lot of things that I wanted to do that I didn't. It's like, oh, go to med school, do that. You just didn't have time. And
Hmm.
I've always really enjoyed fashion and design, and so I enrolled back in school, and I'm taking classes to get my fashion certification, and then part of that was like getting to, so I started a medically inspired jewelry line. And then I'm doing other like clothing and things like that. So it's just something that's like feeding a different passion for me.
Yeah. And you start to learn that you can't operate forever, right? I mean, I'm over here stretching my neck. It's like I'm sore. I told Dom this before. My father was a roofer. I used to roof houses with him, and he would look at me like, "You're doing this so when you're older, you can use your brain, not your back." And
Yeah.
I'll call him from time to time. I'm like, "Dude, I'm still using my back, man. I make more money than a roofer, but I'm just
I,
labor. I'm an
I don't
expensive
think the
laborer."
average person realizes how physically demanding our job actually
Yeah,
is.
no, honestly, yeah,
No, I mean,
true.
I think it's, I mean, obviously, maybe because I'm hanging around all you guys, like I
Yeah,
see how physically demanding it is. I mean, first of
yeah.
all,
It's one of those things.
it's mentally draining. It's physically, you're in positions that you're stuck in for a while. I mean, this is hard on you guys.
Well,
I'm sorry, but I can't, I heard medically inspired jewelry line, and I think we
yeah.
got to take a pause and just get in on that a little bit.
Yeah, so
Let's talk about that.
okay,
What
I
is
don't
it?
know if you can see this. Like, so this is one of my pieces, this bottom one. Can you
Yeah.
see that close up there? So
Yeah, I can see it.
yeah. So it's a pair of boobs. But
Oh,
but
Nice.
but
But
my I
I wouldn't have thought that, by the way.
well, and that's the thing is everything looks pretty by itself. But like I did scalpels, I did all those things. Everything's like real. So I'm a little bougie with some stuff. So
yeah.
everything's like real gold, real silver, and diamonds. And but I actually cast scalpels. So like a 10 blade, I have a 15 blade coming out. And it's just because I was like, wait a sec, this is my market. I know this market. This is what I'd want.
Yeah.
And so
What about a 15C for the facial?
a
I mean,
15, actually,
uh,
I'm doing a 15C because it's actually,
okay.
you're going to laugh. That's what my tattoo is. I have a 15C on my
See, okay, I
arm.
like it. Good job. Yeah, I
um,
appreciate that.
but yeah, so I'm doing a 15C because it looks more elegant actually as a
Yeah, it's a little
necklace.
more slender, a little
Yeah,
more slick.
yeah.
Yeah, I like that too.
But if there's a lot of like kind of chintzy jewelry out there that's medical. And so I was like, okay, I know, especially women plastic surgeons
Yeah,
who would love to wear this type of stuff. And so it's done really well. I have like a little
yeah,
hemostat necklace and things like that. And so a lot
nice.
of it's just been like looking at stuff we have and then turning it into jewelry.
How do we
Is
buy? I got to get my fellow something for Chris for this year. How do I? How do we? You ping me later. Let me know.
I will
Well, I
definitely.
mean, tell everybody. You might as well tell everybody now. You
So
might have to
yeah,
keep it a secret.
a
there's
little
actually
plug,
there's
Ben. Jeez.
there's two ways. So one is off of my, it's not my practice website. I have a separate website. It's vinayarednam.com, and you can see my whole collection on there. The other place you can buy it off of is Lady Spine Doc Shop. So I did a
Oh
collaboration
yeah.
with her as well.
Okay, we'll make sure we get that in the comments,
Yeah, that'd be awesome.
uh, so we can link to it. And then, is that part of kind of some of the angel investing? I noticed that was on your bio. Is that kind of
Yeah,
part of what you're doing?
that's part of it. My husband and I both do a lot of different investing in different things because, like you were talking about, man, you got to
Yeah.
think about the future, right? Like,
Yeah.
I feel like we're similar to athletes, pro athletes, but we push
Probably.
ourselves beyond sometimes what we should
Yeah.
with our bodies. And so, my goal is I love operating. I want to do as long as I can, but we want to be able to have I want to
Yeah.
make it
Not
to where
every.
it's not my I have to
Not
do
every
this.
day. Yeah. Forever.
Yeah.
Yeah. Yeah. Yeah.
Yeah. So there's a lot of different medical companies that I've invested with, just products I believe in. If I use it and I think it's good, a lot of times I'll reach out to the company, especially these smaller companies, and just be like, hey, are you looking for investors? I think, if it's something you're using already and you think it's a good product, I think it's worthwhile to do it. And then I do a lot of different real estate investments as well. And so it's just, I've learned a lot about business through that. And I feel
Mhm.
like all of that applies back to running your own practice as well.
And how are you kind of balancing kind of work and branding and normal life and investing? Like, what are you doing? How do you keep sane? Those are the things we really get
Yeah.
interested in.
I don't really balance it. So what I will tell you is like a year ago, I finally hired like a personal assistant, and that made a huge difference. Just
Yeah.
literally, it sounds silly, but having somebody go fill up my car with gas, like it's just stuff that like I can save time on. But then
Hmm.
she also helps me with all my basic stuff, and that's made a big difference. I have a pretty awesome team at work, who I feel like really keep things running smoothly. And then I have a badass husband who really does help me with everything. So I think that, some days you're better at one thing than another. But I don't think to date anything has suffered because I put too much time into one versus the other. But I just
Right.
pick and choose which days. I think I do utilize a lot of my, time, that off time, to do the non-medical things, which maybe other people just be hanging out and doing whatever. But I feel like I'm just a person that likes to be busy. I like to keep creating things.
Well, that makes sense. And you seem like you stay pretty fit too, right? Like in general, like you're exercising, you're taking good care of yourself.
I used to, before my kids, I was a big CrossFitter. I mean, I get up at like 4 a.m., go work out and shower
Oof.
at the surgery center. I don't do that anymore. But I do. I stay pretty active, and like I said, Lipo 360 is a really good
Yeah.
workout.
Yeah. I'll wear my Aura ring every now and then.
Yeah.
Forget to take it off, and it'll log exercise.
I always laugh.
Yeah.
I'm like, removing other people's fat is one of my best workouts.
Yeah, that's pretty good actually. It's kind of motivating too. When you see it, you're like, oh, I'm not gonna have that hot dog later.
This right shoulder was destroyed by CrossFit, so I'm right with you,
Yeah.
and it's still working out, but yeah, not as hardcore as I was in the
Oh
past.
man, I was a
But you,
pregnant CrossFitter. I was hardcore, but I stopped.
They're getting a
uh,
little bounce back. I think a lot of people are they're wearing people
The
out, right?
breaking down, yeah.
Yeah, it's a young person's game.
Well, it's actually a really good example of the idea of CrossFit when you think about it. We'll take just a 60-second departure here. When you have a bunch of people doing exercises as fast as they possibly can and not focused on form, you're gonna get hurt. Like
Hmm.
it's that easy. I mean, CrossFit has to be like an orthopedic surgeon's like dream, because you're just got a lot of people that don't have form, and I think it makes sense when you have people that like don't know what they're doing.
Hmm.
It's dangerous, right?
Yeah.
Speaking of people that don't know what they're doing and it's dangerous, I'm going to bounce back to
Ooh,
a really interesting
transition.
topic. Do you
Yeah.
like that? Do you like that? It's
That
pretty
was
good,
great.
right? Look at Ben. How many podcasts in? Did you see that transition?
It was
What would
smooth,
you
man. I mean, I knew you would be.
maybe a 9 from the Michigan judge? What I would say is, where do you stand on the filler debate out there? Of you got surgeons trash and filler, you got social media people trash and filler, all that kind of stuff. I'm just curious where your head's at.
You mean like the debate, like no filler at all versus
No filler, filler sticks around, filler makes surgery more
migrate?
complicated, all that migrating, all that stuff. What are your thoughts on
Dom
it?
owns like 45 med spas, Mavi. Before you answer the question, he's kind of snaking you in there, but
Hmm.
I'm not anti-filler at all. I'm anti people who do bad fillers.
Hmm.
I think that there's a time and place for fillers. What's the whole Mar-a-Lago face, like the overfilled puffy face or whatever. I don't like that aesthetic. I'm a big fan of fat grafting, right? I think that that works really well for the face. But I mean, I've had fillers in my face before, so I don't think that's a problem. I think, like I said, I think it's just overdoing it or doing too much at once can cause problems with it. But I also think for the surgeons who have issues with it, I actually talked to someone on my podcast recently about this, and he's like, well, it depends on what plane you do your facelift in, too, right? Whether
mm,
that's going to be a problem for you or not. And so, I don't think fillers are evil. I think the
yeah,
operator is really, really important. And I think we got a lot of bad operators out there.
We
yeah.
got a lot of bad operators out there. And
Yeah.
just for clarity's sake, almost all of our clinics are all doctor ran clinics. They're some of the best in the world. Um, But we feel the same way. We feel that it's not about the filler, it's about whose hands that
Hmm.
filler is being administered in. And we think that, there's just a lot of miscommunication, and we're kind of making a little bit of our mission to make sure that we kind of clear up some of that
Hmm.
miscommunication out there. Um, I'm feeling like it's starting to kind of
Soften a little bit.
yeah,
Yeah.
I'm starting to feel like it's softened a little bit. I don't know. I'm just curious about what you're seeing.
With like
Do you
regulation.
do you are
No,
you
no, more
solo
along
solo
the
or
lines of just more along. Sorry, Ben and I, we're
yeah?
so excited. We have so many questions.
Are you solo or do you have anybody injecting? Do you have nurses injectors or do you do
So
everything?
no, I'm not like so. I guess we're set up like I have med spas too, but they're separate from the
Yeah.
practice. And then,
Okay.
but like so on my surgical side, I don't. I do my own stuff. And I
Uh-huh.
have a PA who does some stuff as well.
Okay.
But pretty much majority of like our fillers and Botox are done in our spa by nurses.
Yeah. Okay.
Yeah.
And would you? I guess. Sorry, and I lost my train of thought on that. But I just want to say, from a filler perspective, um, again, in the right hands, I think it makes a difference. What I'm wondering is, we're starting to see maybe people starting to turn a little bit in the sense of everyone was really anti-filler, I would say the first half of the year. And the second half of the year, we're starting to see people kind of go, well, yeah, okay, I think I'll listen to my doctor or my healthcare provider and see what they have to say. And I'm just wondering if you guys are seeing anything differently there too.
I think from a like I think from people who've been coming in, like the people I've been doing injectables for
Yeah.
years, like none of them have listened to that. I think that like you do every once in a while, someone come in and like who's new, and they're like, I think this is migrated filler from like a decade ago, and I'm like, I don't think. I think you just aged. I don't think
Yeah.
that's your filler that migrated. And I mean, none of the studies show that like hyaluronic acid should
Yeah.
stay around. It doesn't Science doesn't make sense there to me. So,
And my argument is always like, if that's the biggest complaint is it goes away too quickly, right?
yeah.
If there was a product that stayed 10 years and didn't cause granulomas, we'd be using it. So yeah, I think it's just a communication thing. It's this one thing the social media world and influencers on the social media world have they try to oversimplify a very complicated scenario, right?
Hmm.
Very complicated aesthetic, very complicated anatomy, very complicated physiology and science. It's like filler stays there forever. It's like, well, no, I mean, it's a product you have in your body already. You're going to break it down, So, yeah, it's one of those things. I think
Well,
that's the. No, go ahead.
I was gonna say controversy sells, right? Like, so if
Yeah,
they
exactly.
figure,
It's hot. It's much hotter to say something crazy than the truth. Yeah,
yeah, yeah.
I
Well,
completely.
this is like weird, but I remember a lady came back to me 10 years after I did lipo on her, and she's like, it doesn't look the same. And she clearly gained a ton of weight and had a
Yeah,
baby. And I was like,
yeah.
she
It's
was
like,
legit, like, it doesn't look the
yeah,
same. And I'm like, well, yeah, I mean, you gained weight and you had a kid. I mean, what do you like? But in her
yeah,
brain, it was like she was just ready to be angry at the doctor, you know?
yeah,
And I think that's kind of what this is too. It's like very easy to be like, it's right now, especially, it's like the
yeah,
doctors are the enemies. And so,
yeah.
this happened because the doctor wasn't honest with me. And so,
Mhm.
yeah, I do think it's softening. I think that now there's newer things out there to be angry at us about.
Yeah, yeah, that's true.
Funny.
It's actually probably a good sign for the world if people are complaining about that kind of stuff. You know what I
Yeah.
mean? The world's not crazy enough to keep people occupied. Yeah.
Yeah, Ben and I were having we were just having a debate last week about a lot of celebrities saying that they're not getting Botox and filler,
Oh,
but
yeah.
when you
Seen
look
that.
at them, you go, you're actually getting Botox and filler. Like we actually know what a face that has no Botox and filler looks like. Whether you're getting fantastic treatments with great outcomes,
Hmm.
but we can tell and we see it. And I think there's this whole thing of saying, okay, I'm now going to deny this.
Yeah. Well, I
Yeah.
noticed, yeah, some of them are like, "Oh, I want people to see what a naturally aging face looks like." Well, guess what?
Yeah.
It depends on your ethnicity, your sun exposure. There's so
Yeah.
many things.
100%.
There's no such thing as naturally aging face. So I don't know. They just want to stand out and look special, I guess, But and
Yeah. I mean,
and
they make money by their face, so they do
yeah,
what they or their whole bodies, everything. So
yeah,
Well, and sorry, let's go back to the confidence doc here.
uh-huh,
Like we were saying that Ben and I were also debating the fact that, you know, nobody should actually really be allowed to have any commentary on what anybody else does. If that makes them happy and makes them feel good, then that's it. That's it. Full stop. End of story. Like leave them alone. One one thing I was just going to ask you um, is there surgeries that you see out there that are like being done or being talked about that you're like, nah, don't do that. Like that's not a good thing. Is there anything
mhm.
out there that sticks in your head that you keep seeing or hearing about and you're like, I need to tell people not to do this?
So for body stuff, I can't think of a lot of things. For facial stuff, man, there's like so much stuff. Like a lot of this stuff come out of Asia, where there's just like direct
yeah,
excisions, and these 20-year-olds around their lips and like brown,
yeah,
like I think there's just a lot of very extreme stuff coming out of Asia, that I think is concerning and I wouldn't touch. I can't say with body stuff. I feel like the big BBLs are going out. Um, you
yeah.
know,
Definitely, you don't see those as much. Yeah,
but we are getting more people wanting reversals of them, and it is hard because they don't understand that
yeah,
reversal isn't just sucking the fat out. Like you've stretched out this tissue thing, so really reversing a BBL involves like a lower body lift now. And that
Mm.
sucks, especially when you're young and wouldn't have otherwise need that.
yeah.
But yeah, so I would say mainly it's been a lot of crazy facial stuff that they see, and I'm like, I can't believe people are letting someone do this to them.
Got it. And what are you seeing trending in breast augmentation? Is there anything like trend wise that you're seeing?
I think that seeing a lot smaller sizes. Like I know this is regional too, right? So it depends on where you're at regional wise. And I mean, I'm in Texas, so there's still plenty of women who want like very full cleavage, but I'd say that like you're seeing a lot more people who are like understanding a little bit more that that breasts would age better if they're not quite as big.
Hmm.
And so that's been kind of nice because that's I like that personal aesthetic myself. And that's how I talk to people about it. And I'm like, okay, you can go bigger, but just like anything, you add more weight, it's not necessarily going to age as well as something that's a little bit lighter. And I feel like I don't know, they keep calling it the term the ballerina boobs, or I don't know, they come up with a name for everything. That was kind of going around this year, and it was just the idea that you can have an augmented look without initially being huge. So I
Hmm.
think that I am seeing that more where people are coming in wanting something more subtle.
That makes sense. Yeah.
Yeah, the
Um,
natural, subtle, sneaky kind of stuff is hot right now.
Yeah.
Natural, subtle, sneaky. I like that,
Yeah.
Ben.
Well, it's
I like
basically
that.
Hmm.
like you have plastic surgery, but well, it's what we want, right? You have plastic surgery, but
Yeah.
nobody really knows you have plastic surgery. I mean, that's good. That's
And
good work.
it's nicer to deliver. I mean, I definitely get the people that want the extreme change. They want to like a completely different person. And then you're like structurally changing them at the same time. You got to
Hmm.
mess with the fat and the skin and the muscles. It's like it's complicated. So sometimes nice natural is a nice thing to deliver.
Hmm.
I mean, that's aesthetics in general, obviously, right?
Yeah,
Right.
probably. Yeah,
Where
good point.
the
Yeah.
the the best outcomes are the ones that you can't really notice.
Yeah.
And I think that's a big part of it. I'm curious, just from like in your field and what you're seeing and everything, is there like any breakthroughs around the corner that you got your eye on? Is there anything that, like, you know in 3 years from now or 4 years from now, there's something new that's going to kind of hit the market that you're like, okay, this is where this is going? Are you seeing any trends?
Um, I mean, I think it's always been the focus for scar care, but I think we're seeing more stuff coming out that's really thinking more about like the mechanics of scar care, right? So there's multiple devices now for like tension reduction. I think what I would like to see, I don't know what exact is out there, is more stuff that's going to be working on pigmentation, because there's a
Mhm.
huge population of people who hyperpigment, and it can take a really great result and not ruin it necessarily, but like take away some of the positive because the scar is super obvious because
Yeah.
of pigmentation. So that's something that hopefully somebody super smart is working on. Like, because
Mhm.
I mean, if we do all the right things with the scars, then it may be something that required more, that's like some sort of pre-treatment or medication
Yeah.
in order to
Like
reduce,
a melanin antibody or
right?
something weird. Yeah.
Like
Yeah.
there was that really horrible 80s movie, like Soul Brothers, something where he took these
Oh, it's
pills.
Soul Man.
Soul
Yes.
Man, yes,
Yes, that
right.
was
So,
it.
so we just need the opposite of that.
Yeah.
That was a terrible movie.
Yeah. I
Um,
mean,
but yeah, so that's something I'm excited to be able to see coming out there, and I think that we've gotten now these new products, right, that are like preserved fat. To be
mhm.
able to see that in larger quantities for less money because they're really expensive right now,
Right.
that would also be something that I'm really excited about. And I feel like that's coming around the corner because what's available now, like a few years ago, was only like 1 cc's, and now you can buy it in 25 cc's, 50. So I think that that's going to be a big, exciting thing.
That's that is exciting, because there's so much you can do with that, obviously,
Hmm.
right? That's great. Um, we like to ask every guest these two questions,
Okay.
and these are fun questions, right? Is there something that either you do surgically or non-surgically or whatever it is that you feel is just absolute magic that, like, people should know about and do? Is there something where you're like, this is like everybody loves this and it's just such an amazing product or device or procedure? Is there anything like that that you feel is like just absolute magic?
Like a procedure that I do that I feel is.
Again, it could be any of those things. It could be a procedure, it could be non-surgical treatment, it could
Piece of
be
Yeah.
jewelry.
device, a piece of jewelry. Yeah.
I will tell you, I think I do a pretty amazing fleur de lis body lift. I think that that's a hard procedure and people
Whew.
shirk away from it because of that vertical scar, but I think I do an amazing fleur de lis.
Can you explain, just for people out there that
Uh-huh.
don't know, what a fleur de lis, which is myself? Go ahead.
so, so with a tummy tuck or a body lift, you're only talking about a horizontal, low horizontal scar. But specifically in the weight loss population, you see people who have not just vertical laxity, but horizontal laxity. So I could pull till the cows come home, and that's not going to take care of that horizontal laxity. So for them, I'm actually pulling in the middle. So you end up with a vertical scar down the middle. So there's a couple of reasons why people, one is that scar for a lot of people is unpredictable and it can look really ugly. And they're like, oh, I have this scar down the middle of me. The belly button looks horrible. So I actually picked up from a friend who just makes a new a neo umbilicus. So I completely cut their belly button out and I make them a new one in it so I can predict how it looks. So it looks really natural. They don't get this huge hole that's gaping in the
Yeah.
middle. And then in the way that I close that central part, am I allowed to say a product name on here? I don't want to.
Yeah,
Of
go
course.
for it.
Yeah. Are you
So
kidding?
Shit,
Yeah,
so
it's
give them
all
all
good.
in, make them
yeah,
sponsor
By the
us.
way, we might
Fuck
get
it,
him
we
as a
don't care.
sponsor. Like, just
yeah.
bring him up.
So
Yeah.
so I use Bridget's, like those little clips. They have been a
Yeah.
game changer for me. I use them on arms, thighs, everything. Like the different like. But when I started using those like 2 years ago, like my scars look so good because the biggest problem with the fleur de lis is tension. Because especially if they have big breasts or something like that, it pulls at that. It offloads the tension on there. I still close it the
What
same
is
way.
it? What's it called?
Bridget's Brijjit. They're little they're stickers. They're literally little stickers on there. Monty Eves is the doctor who developed them.
Okay.
And like, but like you literally just stick them on a centimeter apart and they offload enough tension. It reduces the breakdown by like 90%. And the scars look super thin. And I keep them on for like 6 to 8 weeks, and then I do my scar care and
Oh
stuff
man.
like that. And honestly, like the fleur de lis, just it just ends up looking like a little bit of contouring for their abs. And so it's been a game changer. And so I won't tell you the best at everything, but I know I'm really good at those. Like I get really great results with that.
That was
That's the
really good.
key. I try to tell patients that you want to go to the person that does that thing
Hmm.
super well. Because the horror, you hate to see people that get bad plastic surgery, and nobody's doing bad plastic surgery on purpose. It's just, they're having a complication,
Yeah.
but the only way to reduce complications is somebody that's doing more and more and more of them. And then you do more of them, you get better at it. It's like this cycle. So you got to find that person. If it bugs you, no, send this person there, that person there. And I think it's okay. A lot of people go, they want their whole body, face, neck, bleph, ptosis, everything repaired at once. I'm like, there's not many people that can do everything
Hmm.
awesome. So just keep that in mind when you're finding somebody.
Yeah. And
Yeah, that
it's
was
hard. I get it. It's hard to like figure out like who's good. You go online, everyone's website's like, I'm the best for
Yeah.
me or whatever. So it's hard.
Yeah, no, it is hard.
yeah, but the way you explained that was great. Um,
I really love the surgery. I mean, these are people I'm taking like 25, 30 pounds off of, and it's like they come out looking like literally a whole nother person. Sometimes you look at their driver's
That's good.
licenses before they lost the weight, you can't even recognize that
Yeah.
they're the same person.
Yeah. Yeah.
really great. The opposite of that question is,
Okay.
what do you see out there that people are either talking about or anything you just think is bullshit?
Ooh.
Like that you look at and go, everyone's talking about that, but this is bullshit. Which, by the way, we've just had we just worked on some content with our doctors just about salmon sperm facials and stuff like that. Just
Right.
like, what are you, oxygenated facial? Like, what do you, anything out there that pops you to mind that you think is just bullshit?
Gosh, I think what's been out recently that is.
It could even be out, not even recently, just something that you're like, I don't
Okay,
believe that.
so I mean, I actually initially start did threads and like facial threads and like I think that in the right person, maybe they still like have some benefit for a very short period of time. But that was something that I literally took my content down from years ago because I was like, I'm embarrassed that I was like, yeah, these are great, let's do them. But I just don't think they have much benefit. And I know there are docs that are out there that swear by them and all that stuff, but I don't know. I think it's a lot of money for very little gain.
I'm going to argue with that. I'll tell you, I have a group of like model TV people that do
Yeah.
events and they come before their events mean, they still drop a couple $1,000s. I tell them it's going to last like, 3 weeks, a month
Yeah,
max, but they love it because during that little event, I mean, they look tight and hot and they get that lift. So I really, I think most of that kind of shit, it just comes down to transparency. People are going to hate it if you tell them it's going to last a year.
yeah,
They're lying if they say it's going to give you a facelift. But if you're going to be on TV and you want to look a little tighter, come in a week before. Those are what people post on Instagram and say it lasts forever.
yeah,
So I think a lot of that comes down to the transparency. People way over promise the outcome that they're going to get. But in
yeah.
20-year-old who's going to be on TV next week, I can make her look good in threads for a couple
So,
weeks.
so
Like,
I totally agree with you on that. Like, I have no
yeah,
problem with that. But like, the problem is the average person that we see who comes in for this is expecting like the non-surgical
65-year-old
facelift.
woman
Yeah,
who is, yeah, yeah, yeah.
you're like, I
Yeah,
can pull these and
that's the
pull
thing.
these. Nothing's going anywhere. So,
Yeah, yeah. I'm with you. I'm with you.
yeah.
Okay, yeah.
I
But I
guess
think it's like no. It's just when it comes down to it, like all of this, there's unfortunately I mean, we're doing medicine, but we are also a business, and I think if you're honest about it, you'll give people good care. They'll be happy. But there's people who maybe take the business component a little too seriously, and they're not giving people the honest care and treatment. And I think fillers have done similarly. I think threads, like when they're either overpromise or they do too many, or they're
yeah.
putting them in the eyelid or the nose, or that's when you got to be a little careful.
The other thing I'm a little bit, which I don't know, because I use devices, so I'm not like anti-device, but I'm just wondering long term how some of these heat-based devices are going to age, because we don't really have long-term data on any of this stuff. So I'm just curious to see. Hopefully, it will be an okay thing.
Yeah.
That's really interesting. Heat-based devices is what you're concerned with.
Yeah, I just don't know. I mean, I've been in necks or in bodies after somebody's had like some of these tightening devices, and it's not great. But if it holds up, then great. But like, I just don't know how, and I don't think
Yeah.
they're all the same. So
You'll learn, Dom. Surgeons are slow adapters to new stuff because it's just like if it goes wrong, it can really fuck some stuff up. You know what I mean?
yeah,
So, like, I'm yet to find. There's all sorts of these J plasma thing. I normally tell the patients, why there's 50 different devices because none of them. I mean, they keep coming up with the one that's going to work. But you just see people getting burned from it. You see sticky, you see little contractures, whatever. And
hmm,
then the old classic, like cold steel, lipo, whatever, maybe some assisted lipo. It's just hard to beat the predictability of something like that.
yeah,
So it's like surgeons and pilots, it's hard to take on something new and be like, I wonder if this will work.
yeah. There's a big risk with
You know,
it.
yeah, you don't really want your surgeon or your pilot to be doing something like, I'm going to try this out today.
But
Yeah,
probably fair to say it's not all devices. The right devices also being in the right hands
yeah.
is
It's
Similar, of
same
really
course.
like
Yeah.
same
important.
like fillers. Yeah, like
Yeah.
Yeah. Do you have your folks do any kind of like, let's say you did a tummy tuck and it's like 6 months later, whatever, past the healing process.
hmm,
Where do you sit on like muscle stimulation and those types of devices out there where they're really trying to push a lot of these things, but I think it's hard for people to get their head around is like, okay, you're going to put this thing on me. It's great, but I got to come in X amount of times and I got to get it all done. Like, where do you stand on that?
So I think some of those devices work great, but I wouldn't suggest it for someone who's not going to actually maintain it afterwards. Because like, if you're a patient that works out all the time and you go to the gym regularly and you want to like get a leg up so you can see those muscular results faster, then I think that's great. But if you don't keep doing those stimulation devices afterwards or can maintain it in the gym, it's going to go away and you spent a bunch of money for nothing. So I
Right.
just, yeah, I don't think they're bad. I just think that, again, you have to be realistic. Are you going to keep it
Yeah,
up?
exactly. You're going to the beach, you got your vacation coming up in a month and you're going to
Yeah.
pound it out for it to be good in photos. Great.
Yeah,
You know,
exactly. If you got a short
yeah.
term goal with this, it's like high def
Yeah.
lipo. I'm not going to do high def lipo on somebody who doesn't actually work out because they're going to look like they have Hawaiian rolls on their abdomen after a while because they're not putting in the maintenance with it. No, it's like,
By
Yeah.
the way, that was hilarious because I could actually picture those Hawaiian rolls.
Yeah, it did. That was
right.
yeah, it didn't
I think
it
I've
did make
seen
me
some
look at it.
people's results look like that
Yeah.
on
Like
posts.
poor guy. That's great.
Listen, that was great. I've peppered you with a million questions, and I so appreciate that. Ben, I don't know if do you have anything else for Dr. Red?
No, man, she's on fire. I love it.
I
I want
want
to
to
see
get
more of the jewelry, more of the
I
fashion.
want to get the
I mean, I love your
plugs in.
surgeries. You're obviously a great surgeon, but I like that. I like kind of thinking outside of the box. I think you're onto something.
Yeah, thank
Yeah.
you. Thank you.
Yeah.
And I want to get the plugs. I want to make sure we get the plugs. So you also
Mhm.
have a podcast. Can you just
I
talk about
do.
that for a second?
Yeah, it's the Confidence Doc podcast, and we obviously have lots of plastic surgeons on, and but I also expanded now, so we have different types of business entrepreneurs on. The whole purpose is just like people who are out there killing it, and I think we can learn
Yeah.
from each other. So it's going to be fun. We are just starting our eighth season. It was like
Amazing.
coming up. Yeah, so it's been awesome. It's been awesome. I've really enjoyed it because I've got to meet so many cool people through
Yeah,
it.
it
You
is
know,
cool,
it's
right?
yeah.
And you have a hyperbaric, I believe. Do you have a
I
hyperbaric chamber in your
do. We
office?
have hyperbaric
Yeah.
chambers now. I love it.
So that might be helping your lift also.
Yeah, yeah.
I mean, are you making these people dive, or what do you do?
Yeah, so we have them do 2 before, 3 afterwards.
Yeah.
For
You
facials,
know,
we
the
don't do as
before,
many.
someone was just telling
Go ahead.
me, I didn't think about making people do it before, but the literature must kind of support
Yeah,
that, huh?
there's we have protocols that are set up like that, and so for like body cases, we do 2 before and 3 after, and it's great.
Okay.
It's great. Have you ever
Yeah.
been? Have you ever been in chamber? I actually want to try.
Yeah.
Have
Yeah.
you? Okay.
No, I went 30 days straight. I
Really?
paid like $15,000. Yeah, back in the day, I was just playing with it.
Yeah.
And I mean, you've never been in?
No, I need to. I want to go
Oh,
in one.
you like you feel amazing after. You
Yeah.
literally like you get after you're like, holy smokes, I feel like I could run a marathon. It kind of tapers off after a couple hours. It
Yeah.
feels like I know there's long-term benefits, but it's a
When
cool
one of my
sensation. Yeah.
partners had an injury and she was in there and she's like
Yeah.
the best part was she's like I couldn't take anything in there with me. So she's like it
Yeah.
was an
Yes.
hour unplugged and I was like, "Oh, that's
Exactly.
crazy."
It's true. 100%.
Yeah,
Yeah.
Ben and I talked. I had a 90-minute session by myself,
Yeah.
and
It's
it
like
was like we
it's a
think
little
it's there.
creepy. Yeah.
And we're big fans of MD Hyperbaric. We think they're amazing, and so that's great. But before, look at that, Ben, huh? People
What's
need to
that?
know
Oh,
before
before surgery.
Yeah.
Yeah, no.
before
I had
surgery.
heard that recently, and I mean, it makes sense. Just get the tissue ready, prep it. It's like
Yeah.
I tell people, you want to prepare like you're gonna run a marathon before surgery.
Yeah.
You know, people are like, I'm gonna go have surgery. It's like, no, this is a big deal. Like your body's got to heal. I mean, I'm injuring you majorly.
Yeah.
You know,
Well,
so
and I think there's
yeah,
a lot to like if you come in exhausted for surgery, you're already depleted.
yeah,
You gotta be fresh. You gotta be ready,
yeah.
for the
You're gonna be
challenge
ready to
of
roll.
recovery. So, yeah, no, I
Mhm.
love it. I'm very, very excited about having that.
Good.
Oh,
I like
hyperbaric,
it.
love it. Well, Dr. Rednam, thank you so much for joining us. It's the Confidence Docs, the Confidence Doc podcast.
Hmm.
If you are in the Texas area or not in the Texas area, and you need something body, like if I got a body thing, I don't know. I make a
I
trip.
saw your eyes light up when she said that high def lipo. Get
Oh,
ready to go
I
out.
mean,
Yeah.
listen, I'm ripping
I
work
may have
up
spent
all
some
day,
time
but
down in
still.
Colombia with someone to learn things.
Yeah. Yeah.
Right on. Well, listen, it's so cool, and thank you so much for joining us. And we hope you feel better. But we really appreciate you showing up and spending time with us. Thank you so
Well,
much.
thank you both for having me on. This is fun.
All right. Yep.
Take
Ciao.
care.
Take a break.
Thanks.